All right, so the next thing that we're going to talk about is some postoperative care after a quadricep tendon or a patella tendon rupture, and this is after surgery, after a surgical repair. Typically, you'll be in a brace such as this, a hinged knee brace, usually locked all the way straight so that the knee is not allowed to bend. You can see our postoperative dressing here, an ACE wrap, and then the brace on just like this. And so it's important to really avoid moving your knee in a certain way after these types of surgeries so we can minimize the amount of stress at the surgical repair site. And so when you're ready to take the brace off and to take the dressing off for the first time, we'll try to avoid those certain positions. So go ahead and sit up, and so we'll sort of illustrate this here. So to take the brace off, all you really got to do is undo the straps like this. Just like we showed before, the brace books open just like that. Now, what we don't want to do is have you lift the leg out of the brace like this, because what that'll do is put a ton of stress on the repair site. And so without lifting the leg actually out of the brace, if you're by yourself, what you can really easily do is, if you're on a surface like a couch or something like that, you can really easily just sort of push the brace just right out from underneath you. And so you can see, leaving the leg straight down like that, we're going to push the brace out from underneath your leg without actually lifting it up. It takes a little bit of effort, but that gets the brace off just like that. And that's really how you would do it without lifting the leg up and out of the brace and stressing that repair site. And then in order to change the dressing, you can, if you have the ACE wrap on, you just peel the wrap off like this, and you're going to push it down under the leg, and you can see how that really easily comes off. Pull it off like that and push it down underneath, and that avoids you, again, having to lift the leg up, hold it, which stresses our repair, and then you actually unwrapping it like that. Okay, so we're again talking about patella tendon or quadricep tendon repairs in the post-surgical period and how we take care of the leg during that time. And so we talked about changing the dressing if you're by yourself and having to push the dressing out underneath your leg without actually lifting it up under your own power to avoid stressing the repair site. If you have an assistant, it's a little bit easier to do this, and so I'll act as the assistant here. And so what you can do is you support the leg, just hold the leg up just like this, and you'll see her quadricep is not contracted. She's letting the whole weight of her leg into my hand, and so we're not stressing the repair. And so while she lets me hold the entire weight of her leg, she can start to unwrap the dressing just like that, and you can see you've got room underneath to do it. Again, she is not using her quad to hold the leg up. I'm holding the leg up for her, and then she can just unwrap the dressing just like that. You can stop right there. And then you can take the dressing off, replace a new dressing, and then you can just wrap it back up, obviously taking the whole thing down like that. But again, the assistant holds the entire weight of the leg. She is not using her muscle, and that avoids stressing the repair. And then she just lets me lower the leg back down to the table just like that. If you have a brace, the assistant can help hold the leg up like this. Again, she's not using her muscles. I'm holding the whole weight of her leg. We can slide the brace on underneath, and then I just gently let the leg back down after you've gotten the brace in the position you want, and then you just close it right back up.